Imagine fearing that a fall or even a bump could lead to a broken bone. This is reality for many of the 2 million Canadians currently living with osteoporosis. In Canada, fractures from osteoporosis are more common than heart attack, stroke, or breast cancer combined. And osteoporosis is responsible for 80% of all fractures in people over 50. This chronic disease can cause excessive bone loss, can strike women or men at any age, and is often left undiagnosed.
Despite the many advances in our knowledge of osteoporosis, many Canadian patients are still not being diagnosed or treated for osteoporosis.
So unfortunately, osteoporosis can be a silent condition until the individual actually experiences a fracture. And because of this, people may actually not have an assessment completed and miss the opportunity to have the condition diagnosed and effectively treated.
In Canada, only 20% of women who experience a fracture from osteoporosis receive any type of treatment in the first year. Fortunately, new research has led to the first and only bone-building agent that simultaneously increases bone formation and decreases bone resorption, or bone loss, to reduce the risk of fractures. The treatment is called Evenity and was pioneered by Canadian doctor and scientist Dr. Chris Pasty.
So Evenity, which is it's a humanized antibody, it binds to sclerostin and prevents sclerostin from acting as a brake on bone formation. So it frees up the body's bone formation potential, and you get increases in bone building and increases in bone strength.
In Canada, Evenity is indicated for the treatment of osteoporosis in postmenopausal women at high risk for fracture.
With the approval of Evenity, physicians and patients now have another proven therapy to help reduce the risk of these life-altering fractures.
With the ability of Evenity or romosozumab to build bone and even prevent bone loss, it will be of particular value in postmenopausal women at a high risk of fracture.
After 12 months of Evenity, additional anti-resorptive therapy can be considered if necessary. Canadians are encouraged to speak with their doctor about osteoporosis, fractures caused by the condition, and what treatment options might be best for them.